So, Brad, let's start with you. Can you describe for us what the common problem is for these organizations that are, acquiring other healthcare organizations? What are they running into in terms of their legacy EMR data?
So I guess really the problem revolves around what are they going to do with that data, with that legacy EMR data. So typically, any of the acquired practices or hospitals, they may be running on several different types of EMRs, and with each acquisition that they make, they have yet another EMR and that legacy data from that EMR that they have to figure out what to do with and how to make that data accessible to the physicians from their current EMR.
All right, so as I was saying, what's exciting about this session is that we're going to look at a case study, and that's why Mr. Creel has joined us. So we're going to look at the situation at USMD. Could you describe what you were facing there, Mike, so we can understand the scenario?
USMD was formed in late 2012 with a merger of three large medical groups, Medical Clinics of North Texas, which was mostly a multifamily family practice group, Urology Associates of North Texas, which was a large urology group, and a physician-owned hospital, USMD Hospital. When we started, after the merger, when we started requiring other groups, there were a lot of onesie, twosie family practice clinics and urology clinics that were out in the landscape that wanted to join USMD. They were all on differing platforms, and we, as a group, decided that we did not want to support multiple EMRs, and there's a ton out there. So we looked for our options, which were, of course, data conversion, leaving the doctors on their existing platforms, or a third solution, which was the patient archiver. Out of the groups that we have moved to Archiver, there are actually 4 groups that came from differing platforms. On the slide, we had a group that was on Allscripts Professional, and they converted to Allscripts EHR, which is the Allscripts flagship platform. We had another practice that was on Practice Studio that joined, and it's a family practice group, and we used Archiver, and they joined the NextGen suite of doctors. And we had another practice that was on Practice Fusion. Likewise, they were a family practice, and we moved them to the NextGen platform.